Hello, my name is Peter Chin Hong. I'm an infectious disease specialist at UCSF and professor of medicine. I'm going to talk today about Oropouche virus and Oropouche virus infection. Oropouche virus was first isolated in 1961 in my home country, actually, of Trinidad and Tobago, in the eastern side in a village called Oropouche. But since then, it has affected hundreds of people in Brazil, in many parts of South America, Central America, like Panama, and the Caribbean, like Haiti. But the reason why we're worried about it right now, and the reason why it's getting a lot of attention, is because it's expanding its scope and also the intensity. So far this year, there have been more than 10,000 people infected in countries in South America like Brazil, as well as for the first time in Cuba. And in fact, travelers returning from Cuba, about 20 of them were found to have Oropouche virus infection when they came to the United States. How is this disease transmitted? Well, it's transmitted through the bite of not a mosquito primarily, but through the bite of a very small biting fly called a midge, also called a no-see-um. It's super small. People can't often see it. It bites you if it's infected, and about, anywhere from 3 to 10 days later, you can get flu-like symptoms, headache, muscle aches, joint pains, fevers, and in some people you can get diarrhea, nausea, vomiting, belly pain. Some people may also have bleeding of the gums and the stool, but that's more uncommon. What's also interesting about this virus is that in about 10 days, about 70% of people could get a recurrence of the symptoms, even though they had not been exposed again. How can you prevent infection? Well, we can think about some of the typical ways we use to prevent mosquito bites. This is through insect repellents like DEET, through mosquito nets, mesh on the windows, and in the case of uh, this particular virus, wearing long sleeves, long pants, and not sleeping near to decaying banana stumps and cocoa trees where a lot of these midges breed. It's also important to know that there is potentially some sexual transmission because it was detected in the semen of a male patient in particular. And there's mother-to-child transmission as well, causing fetal demise and microcephaly, which is a small head, which we also saw in Zika virus. There are many things we don't know about Oropouche virus infection prevention, so we need to have more research about this. So thanks very much for your attention.